Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. It is election day. If you have not voted, go out, take advantage of being in America and living in a democracy and cast your vote today. Big news coming out of the Rhode Island Department of Health. They are now calling for those who live in the same household as someone infected with the coronavirus to quarantine for 24 days, a major policy change in the state of Rhode Island. We go to Dr. Michael Fine. Dr. Fine, walk us through this policy change by the Rhode Island Department of Health. I haven't heard about it in any other states. I have not seen it in CDC regulations. What is the thinking? What is the implications? And will there be any compliance?
Well, I haven't talked to anybody at the department, and I haven't checked to see if I haven't checked the CDC website about it. So I don't know if it's a CDC recommendation, but it makes infectious disease sense. If you live with somebody who is positive, they are infectious for 10 days. But there's a 14-day incubation period. So, if you get infected from them on the 10th day of their illness, then you may not show illness or positivity for 14 days. And so I think the attempt is to make sure that anybody who is living in close contact with someone who is positive, make sure that they stay home until we know with certainty that their period of likely infection has passed. So that logic is pretty clear. Whether people will be able to do it is a little unclear, and whether just our contact tracing will be able to keep up with the numbers of people who are now positive is very unclear. It's a real challenge to get in touch with everybody who's positive. That's likely 400 to 500 people every single day, and then tell them to tell their family members to stay home for close to a month. That's a real challenge.
Dr. Fine, listen, it's somewhat buried in the bottom of a press release that came out yesterday. It's a major policy change. Listen, getting folks to quarantine for 14 days has been a challenge at best for state officials. Compliance has been mixed, let's put it that way, in the most positive descriptor. You're now asking people to functionally take a month out of work. That might be easy for a white-collar person who already is working from home. Their company has set up workplaces, has technology to support it. But you're asking folks, blue-collar workers, folks out here doing construction, people working in restaurants, people working on a factory line, to take a month out of work.
Yeah, no, it's a big ask. Remember, there are kind of two groups or three groups to think about when you think about quarantine. There's this group, the group of people who live in the same household with somebody who's infectious. There's the group of people who are at contact, somebody who spent more than 15 minutes within 6 feet of someone who gets positive or becomes positive. And then there's the group of people who are travelers from other states, where we've sort of almost given up on quarantine. We have a rule now when you travel from another state that says when you come to Rhode Island, all you have to do is get a test, and if the test is negative, then you're out of quarantine, which makes no sense to me either, because you probably shouldn't have a test at all until 5 days after arrival. Anyway, so we have a lot of confusion around quarantine, and what we haven't done, and I've been saying this for months, is take everybody who becomes positive, pull them out of their house and bring them to an isolation recovery center or isolation hospital so that they're not exposing their family members. That's the way other countries do this. And just think about the economic consequence of if we have 500 people a day and each of the 500 people live with 3 other people, then we're talking about 1,500 people a day out of work for a month or 24 days. That's huge, and it would seem to
listen, based on the numbers we're rolling at, a third of Rhode Island would be in quarantine in 30 days. I mean, that's about the math of it. This seems wildly aggressive, and
But
I.
totally sensible from an infectious disease perspective if you could make it work.
Well,
Again, the alternative is to pull people out of their houses and give them a place where they're not exposing other people to recover.
Uh, the math of this, I guess, is the governor doesn't have to shut down the state. She'll literally have everyone in quarantine after a few weeks based on the way the numbers are going. The numbers continue to expand, 344 new cases on very limited tests, only 9,200 tests. And of those 9,200 tests, over 2,700 of them were at the colleges and universities. And those are asymptomatic tests. By the way, the colleges and universities have almost no infection. They only had 3 positive cases on the 2,700 asymptomatic tests. So the cases continue to go. Hospitalizations jumped up to 177. That's the highest since early June, 4 months. And add on to that, the only good news of the day in the new reporting was that the number of deaths, 2, but that's the lowest number we've seen in a little bit.
Yeah, thank goodness for that. But with this number of people in the hospital, I think that's going to sort of change day over day. And I think that number will trend upward as the number of hospitalizations grow. Remembering that something like 6 to a third of people who end up in the hospital don't survive. We're now at 177 people in the hospital. I think on our way to 200. My guess is the good news is that we haven't seen a doubling of the number of new cases in 5 days. That's taking more like 10 days or more. And that means we don't have sort of like explosion right in front of our faces. But these are still challenging numbers.
Dr. Fine, this new policy, is this, do you run the risk in running in a perfect world, I understand, isolate people for the entire potential of what they could be infectious and could spread the disease. But in a real world, the idea of extending already a very, very difficult 14 days to 24 days, do you run the risk of just losing the public support on this?
I think it's a hard one to keep. I just think it's hard, and that's why I've always been more in favor of pulling people out of their houses. I don't see how people are going to do this, and do it in enough numbers to have epidemiologic impact.
Dr. Michael Fine, thank you so much. Greatly appreciate it. We'll have much more on this change in policy by the state of Rhode Island. Again, it's election day. Get out there and vote. We're going to have coverage all night, starting at actually at 6:30. We'll have Tad Devine, top Democratic consultant, help run John Kerry's race, ran Bernie Sanders' race in 2016, and ran Andrew Yang's race in 2020. He'll be on at 6:30, and then nonstop coverage from 8:30 on, kicking off with Nellie Gorbea talking about how the election went today. Polls close at 8 o'clock. Get out and vote. Thanks, everybody. Stay safe. Wear your mask. Save a job. Save a company. Thanks so much.
Thanks, Josh.